My proposal today is about STD, entitled with #GetCleaned, Say No to STD, a video proposal that will raise the awareness of the students to sexually transmitted diseases, so what they are and how to avoid them. Here are the table of contents in this presentation. So first, what are sexually transmitted diseases? Second is symptoms, cause, and risk factors of STDs, followed by avoiding STDs, and lastly, safer sex. The beginnings. Do you know what you can get in sex? Or do you care for your safety? These are some questions that gives millions of thoughts to everyone once we encounter STD topics. Keep in mind that sexually transmitted diseases, or STD, or sexually transmitted infections, are generally acquired by sexual contact. The bacterial, viruses, or parasites that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mothers to their infants during pregnancy or childbirth, or through blood transfusions or shared needles. Remember, you can only get an STD to someone who has one. And since it's pretty common, often don't show symptoms, you can usually tell if someone has one by looking. And anyone can get one, even if they only had oral or vaginal or and sex just one time. So here are some symptoms. First, abnormal vaginal discharge. As we seen in the picture, it was a mixture of liquid, cells, and bacteria that lubricate and protect the vagina. Second is rashes, pain, and itching in vagina. So since it's understandable already, so we will move to next symptoms, which is pain during urination. This is one of the symptoms if you have STD. This is also known as dysuria. It refers to a pain, discomfort, or burning that can be felt when urinating. Next is fever, lower abdominal pain, rashes over the trunk, hands, or feet. These are causes of STDs. Bacteria, gonorrhea, syphilis, and chlamydia are examples of STIs that are caused by bacteria. Parasites. Trichomoniasis is an STI caused by a parasite. Next is viruses. STIs caused by viruses include HPV, genital herpes, and HIV. Risk factors of STDs: having unprotected sex, vaginal or anal penetration by an infected partner who isn't wearing a latex condom significantly increases the risk of getting an STI. Improper or inconsistent use of condoms can also increase risk. Oral sex may be less risky, but infections can still be transmitted without a latex condom or a dental dam, a thin, square piece of rubber made with latex or silicone. Next is having sex contact with multiple partners. Having sexual contact with multiple partners, the more people you have sexually contact with, the greater your risk. Being forced to engage in sexual activity. Dealing with rape or assault is difficult, but it's important to see a doctor as soon as possible to receive screening, treatment, and emotional support. Misuse of alcohol or use of recreational drugs. Substance misuse can inhibit your judgment, making you more willing to participate in risky behaviors. The only way to avoid STDs is to 100% for sure is by not engaging in any kind of sexual behavior for another person, which is called abstinence. Next is getting tested regularly before having sex, and examining the number of your sexual partners can really help too. Some people decide to wait because of their values and beliefs, or just so much going on or complications. Others might wait because they haven't found the right person or not interested. Now, we decided to have sex, do our thing to practice a safer sex and reduce the chances you and your partner getting spreading of STD. Some example of safer sex are limit your partners, and then get tested. Talk to your partners about your sexual history, and then avoid drugs and alcohol. And lastly, educate yourself about STD like we're doing now. You can also use latex barrier like external condom, but you can also use internal condom. Lastly is dental dam that can use during oral sex. If you use them, these barriers correctly, they can go a long way to protect you and your partners from STD. In conclusion, think about what works for you when it comes to sex and STDs. Remember that not having sex is safest. If you do sex in some point, make sure to practice safer sex to reduce the risk of STDs, and communicate with your partner so that you can protect each other.